Can everybody see that?
Some of you need to come up, feel free to move.
Yes, if you need to move, move. Okay, so first, I'm gonna do the port. So you wanna make sure you have all of your supplies ready. When you guys come to check off, the supplies will be set out like that, and you'll just be responsible for grabbing everything that you need and bringing it to the table with you. So you're gonna have your dressing change kit. Those have sterile gloves in them. I never use them. I always grab sterile gloves. And then your Huber needle and your flush, and then one of these little hubs. You can, like with the Picc, there's sometimes more than one hub. I'm okay with you just grabbing one, as long as you say you're going to change all of them, right? So then you have your clean gloves, and then you will need an extra mask. This is going to be for your patient. So you are going to have all your supplies. You're going to verify your doctor's order and make sure that everything is clear there. With the port, you also have to get the patient's consent. It's not like a written consent, it's a verbal consent that you have to get from them. So you're going to go in, introduce yourself to your patient. So, Mr. Chest, I'm going to be needing to access your port. The physician has ordered some fluids. Is that okay with you? Yes, that's great. Have you had this done before? You need to make sure that they are prepared for the procedure. Most people that have ports have had them accessed and deaccessed a million times, so they don't care. But you want to make sure of that. Sometimes people that have ports will tell you, no, you're not going to access it. I mean, it just depends. So before you get everything open and go in there willy-nilly, you want to make sure that your patient is prepared for you. So he says he's great, he's ready to go. So if anybody's in the room, anybody that is in the room is required to wear a mask. So at this point, if they have visitors in the room, I always tell them you're welcome to stay. If you do stay, you have to wear a mask. Sometimes people leave, sometimes people stay. And then your patient is going to wear a mask. So he's good. We verified everything. He doesn't have any allergies. So now we're going to wash our hands and get everything set up. So that's his mask. So the first thing you want to do is come over and feel their port. Or you guys don't access ports, do you? Okay, so something that I was not prepared for really was that ports can be different sizes. So you really want to make sure that you feel on there and get a good idea of what you're going to be dealing with, because I've had ports that are, you know, this big, and then one time I had to access a port that literally the hub was like as big as my pinky, and it was really intimidating. So be prepared that they may be different sizes. So you're going to come in, you're going to triangulate the port. So this is the outside of the port, right? You know you want to be going in the middle. So we know where we're going to go. We're good. So we're going to wash our hands and set up sterile. If the patient, you can ask the patient if they want any type of IMLA cream. That is going to be something that you have to put on and leave for like 30 minutes. So I've never had anybody use it, but you do need to ask them if they want it, and if they say yes, you would put it on, cover it with an occlusive dressing, and leave it for 30 minutes. Otherwise, you can go ahead and get this set up.
Would that be a nursing order?
I'm sorry?
Would that be a nursing order, or would the doctor have to?
Where I worked, it was a nursing. We had the authority to do that. You can also offer immediately prior to doing this, you can offer lidocaine, which was also a nursing thing. So if they want it, you will have it. So got my mask. patient has his mask on. Okay, so first we are going to clean. That's going to take a minute. So you would pop this, and when you do clean it, you want to make sure that you don't cover the same area twice with this, and then also you go up and down. So this is, alcohol is circular. With these, you go up and down. So what you're going to want to do is start like on the edge, the boundary where the dressing would go, and clean it up and down, and then you're done. And you want to make sure that you let that dry. Your little patch, it says this side up, some of them don't. These are the ones that I'm familiar with, so you want to make sure that this is the side that you see. I know it sounds self-explanatory because it says this side up, but in practice all the time with ports, for some reason, you will see these face down. If that is the case, you have to go change the dressing. So you always want to make sure that you have this side up. This has a little white clip on it. That is there simply for, I don't know, it just comes packaged with it. You want to make sure that you take this off, because if you leave it on, the dressing is not going to apply as well, and you'll have to change it. So very important to take those off, and all you have to do is just pinch it and it comes off. So we're getting ready to break sterile. So you want to make sure that everything is good to go, that you can only have one hand that's sterile. So what you do is we kind of wrap the tubing around our finger just so it's in your hand good. You're going to take this blue cap off, and then you're also going to take the safety cover off of the needle. And then this hand is going to get not sterile, so you need to pick your flush up, get it on, and then you're going to come in when you triangulate. So the biggest part about this is you want to make sure that you're not putting your dirty hand into where your needle is going to be inserted. So just make sure that you're triangulating out here once you break sterile. You don't want to come in and do this, which you wouldn't want to do that anyways, but just be conscious of that when you come back in, you're going to be going out, excuse me, out here, and you're going to try to keep it again to the boundaries of your dressing. These guys are a little bit harder, just so you know, when you do check off, because they move. Real people won't actually do that. So be prepared for that, because we don't want anybody to get stuck. So you've got this triangulated. You're going to have your patient perform the Valsalva maneuver while you insert this. And you're going to go in just like that. And just let that go. So it's in, and then you're going to come in and grab your dressing. so he's dressed. You're gonna want to pull back to make sure that you have blood return. And then you're gonna flush using push, pause, push, pause, push, pause. And while you're pushing, you're gonna clamp. And then you're going to put your initials, date, time, all of that on here. And then you're just gonna document. You need to make sure when you document that you document the, sorry, it's really hot in these masks, that you document the size of the needle, which is gonna be on the package. So these are all 19 gauge 3/4 inch. The other thing I don't think I said, when you are talking to your patient about sighting their Iport, some people will know what size needle they use, some people will not know what size needle they use, but that's very important. 19 3/4 is basically like the standard typically. But if you get a needle that's too short or too long, they're not gonna have blood return, you're gonna have to re-sight them immediately. So I would always ask, do you know what size needle that is used? And if they don't, then I would always start with the 19 3/4, unless they are a very large person or a very small person. You always want to take that into consideration. And that's it on that one for accessing it. So for de-accessing it, you would come in again, introduce, okay, so we're going to take your line out. They're good with that. So wash your hands, and then you're going to have dirty gloves. Not dirty gloves, clean gloves, non-sterile gloves that you're going to put on. And you're just gonna come in and start peeling this down. And then I always hold here, it's not really necessary, I just do from habit. You wanna peel this up. That off, and then you are going to remove your dirty gloves, and get your sterile gloves, and wash your hands. And then you're going to come back in and triangulate, and you want to make sure this is the part where you're at the biggest risk for needle stick injury, because the port holds on to that needle really good. So you're going to come back in and triangulate, and what I do is on the top of this there is kind of like a little nub that you can grab onto that's part of the safety feature. So you triangulate, you kind of hold the base here, and you want to make sure that this hand stays, these fingers stay flat against the person, and all you're doing is pulling out that little hub. And it clicked, which means the safety's engaged, and you're done. Also, you would have the patient, while you're removing it, perform the Valsalva maneuver again. Usually they don't bleed or anything like that. You can dress it if you need to. And that's it on that one. Do you guys have any questions?
So you're literally
So
just,
for the ASEC, we still put the sling on the plate.
Do what?
we still do that for a set?
Like when you check off,
Uh-huh.
you can, it doesn't matter.
When you're putting the needle in, does it click or anything?
No,
You just,
you just go in. I've gotta get one more. Sterile gloves. So you guys are probably more familiar with changing PICC lines, right? So when I was a brand new nurse, I had to change a dressing on a PICC, and I didn't know. I had never done it before, and I went to do it by myself, and I didn't know that they aren't anchored, like central lines are stitched in, right? PICCs aren't. So whenever I took the dressing off, I wasn't holding the insertion site, and it came out, and I literally thought I had killed the patient. Like, he was fine, but I ran out of there, and I was like, oh my gosh, I just moved their central line. What have I done? I had no idea. So that has basically traumatized me for life. And I told the students when I did this for them not to make that mistake because it was horrifying. Okay, so for your PICC, you're going to have your sterile gloves. You need one of these paper tape measures. You're going to have your flush, your hub, clean gloves, and then your dressing tray. So you're going to get your hub ready. You guys, when you check off, will be starting by taking the dressing off, but I don't have one that's already dressed, so we're going to kind of do this backwards. So again, you have your extra mask for your patient. Okay. So he's open, so you would go straight in with this part for the sterile. Actually, I hate this, but you're gonna go into your room again. You're gonna verify your patient. You're gonna explain to them that you're gonna be changing their dressing on their PICC line today. Make sure that they understand. You're going to verify any allergies that they have. They're good to go. So you're going to dress their line. You want to have them, you can sit them up, they can be sitting up in the bed. You want to make sure that you raise it to a good working height. And then you're going to have them put their arm out like that so that you have good access to it. So I don't know why I did that. That's terrible. Okay, so we're going to pretend I didn't do that. So everything's good to go. Sorry, y'all. So I've washed my hands, and I'm going to put my gloves on. So, and you would get your dressing, and your bio patch. And you're gonna put this on and then dress it. Which is kind of hard because there's no arm to grow onto here. And then you're going to make sure that you label it with your name, the date, and the time. Then you've got these that you can change, and you can just verbalize on these that you would do both. And you would flush it and clamp it. So, for taking the dressing off, you're going to come in, verify, do all that, make sure that you're clean, make sure that everybody in the room has a mask on. And the first part of that, of the removal, is going to be to measure their arm. So you're going to take this and you're going to go right just above your insertion site and measure. And when you document, you will document this. So it's like 9 3/4. You're gonna wash your hands and then come in and remove. And this is where I was talking about, you wanna make sure that you have your finger on the insertion side. So you're gonna peel this bottom one off and then peel this one to the center like that. And then it should hopefully just come off. And then if you were doing the dressing change at this point in time, you would take your these gloves off, wash your hands, put your sterile on, and then begin with cleaning it. Do y'all have any questions about this one? My face is so wet. Sorry, those masks are so hot. Okay.
So for the rest of the time, we're gonna let you practice. If you wanna practice Iport, if you wanna practice pairs, or practice by yourself, if you wanna practice maybe Picc, or if you wanna get your equipment for complete head to toe and set it up and start going through it. And we're here for support to help walk you through it. So the rest of the time, it's pure practice. So whatever you feel most comfortable, you need to practice. You can get with someone in the room if you wanna pair up. We had a few come in late. We were introducing ourselves because our get to know each other too in the back.